Welcome to Health Assessment of Children. Today we're going to be discussing pediatric health assessment. We'll be using Chapter 32 of the Ricci text. Our learning objectives are: demonstrate an understanding of the appropriate health history to obtain from the child and primary caregiver, individualize elements of the health history based on the age of the child, discuss important concepts related to health assessment in children, perform a health assessment using approaches that relate to the age and developmental stage of the child, describe the appropriate sequence of the physical examination in the context of the child's developmental stage, distinguish normal variations in the physical examination from differences that may indicate serious alterations in health status, determine the sexual maturity of females and males based on evaluation of secondary sexual characteristics. Let's begin with some pediatric pearls of wisdom. First, kids are not little adults. We do have to take into consideration their developmental status, communication limitations, and differences in physiology. Secondly, family-centered care is a must. Children will present to any setting with a primary caregiver. That might be a parent, grandparent, or other person. And those persons must be included in the care of the child in order for this to be a successful encounter. Kids need frequent well checks to monitor their growth and development, and these are excellent opportunities to provide preventative care and education, which is central to good pediatric care. We always need to be developmentally aware because that is good for everyone, whether there are developmental deficiencies or not. Understanding where a child is developmentally, because we know that's a spectrum. What is normal for one 6-month-old, another 6-month-old might not be quite there yet. So we need to understand what is developmentally appropriate and then use our observation skills to understand where each child is. Finally, nurses are absolutely vital to the care experience for kids. Nurses are often the first person that a child and a family will encounter in any setting, and the way a nurse proceeds with the care interaction will set the tone for the entire visit. So being developmentally aware and providing good family-centered care and education is crucial for pediatric care. As we proceed with pediatric health assessment, the goals that we want to meet are to minimize stress and anxiety associated with assessment of various body parts, foster trusting nurse-child-parent relationships, allow for the maximum preparation of the child for assessment and any procedures, preserve the security of parent-child relationships throughout the interaction, and maximize the accuracy of assessment findings. We'll discuss how we can meet these goals in the next slides. The components of the health assessment are very similar to any health assessment that you'll perform as a nurse. That would include a health interview and history, making sure to be very thorough and complete with the health history, observation of the parent-child interaction, assessment of the child's emotional, physiologic, cognitive, and social development, and finally, a physical assessment. Let's talk about health history. Completing a health history is a really important nursing action. The health history is an overall picture of what each child has experienced. A thorough and complete history can identify problems and indicate where education is needed. This interview to collect health history is usually the first interaction between the nurse and the child, So your approach is very important. There are two types of health histories: a complete and detailed history, which is what might be collected at a well child exam, and then a problem-focused history, which you would collect at perhaps a visit for an emergency room, complaint or injury, or even in an outpatient clinic for perhaps a sick visit. One very important aspect of health assessment is to note family dynamics. And a great way to do this is noticing parent-child interaction during the health history. So some questions to ask yourself as you observe is, does the parent make eye contact with the infant? Does there seem to be a bond and attachment growing there? Does the parent anticipate and respond to an infant's needs? Or does the parent seem to ignore the child? Are the parents ineffective when dealing with a toddler's temper tantrum? Do they get angry and escalate the situation, or do they respond in a calm manner? Do the parents' comments increase the school-aged child's sense of self-worth, or do they seem to undermine the sense of self-worth? Behavioral observations are crucial to the proper assessment of the family's needs. A lot can be learned by simply listening, observing, and perhaps asking a few really good questions. Let's review therapeutic communication techniques and how they might relate to pediatrics. Active listening is a vital nursing skill. Active listening allows nurses to hear important cues and ask important follow-up questions to gather more information to guide not just assessments, but education and affect outcomes for patients. Remember to use open-ended questions to gather as much information in the patient's own words as you can. Eliminate barriers to communication through translation lines, being sensitive to cultural differences, and also observing family dynamics is important there as well. Establishing a medical home means that you are helping to establish a relationship between a healthcare provider and a patient and their family that involves respect and trust and information sharing to provide a wraparound service, if you will, for that family and their complete health care. We'll talk a little bit more about that with health supervision in Chapter 31. Questionnaires can be very helpful to pick out appropriate reading levels, appropriate developmental stages, and it can also help with language barriers if those are given in the patient's primary language. Let's review the components of the health history. Demographic information, chief complaint, or the why are you here today, and history of present illness information, past health history, review of systems, family health history, developmental health history, functional history, family composition, resources, and home environment information. Let's talk about a chief complaint. Simply stated, the chief complaint is the reason why the patient is being seen. We want to collect the chief complaint in either the patient or the caregiver's own words, and then we want to ask deeper questions and figure out a little bit more about what's going on. That would be referred to as the history of present illness, or HPI. We'd want to ask, when did this start? How long has it been going on? Any defining characteristics, the location, signs, symptoms, exposures, etc. We'd want to know about any previous episodes in this child or in the family, any previous testing or therapies. What makes it better? What makes it worse? Things that you've done at home. Have you gone anywhere else to be evaluated? Also, what does this concern mean to the child and the family? Have they had lots of episodes of strep throat? Are they missing a lot of work in school? What effect does this have on the child and the family? And then, of course, we want to have questions regarding any exposures to infectious agents or exposures in school, daycare, etc. Let's review aspects of the past health history. With pediatrics, it's very important to address prenatal or perinatal history. We want to know, was this a full-term baby? Were there any complications at birth? We want to know any past illnesses or developmental problems. We want to know prior history of illnesses, accidents, or injuries, especially that have led to any operations or hospitalizations for the child. Very important, we want to note any allergies, whether they are medications, foods, or environmental allergies, and the type of reaction, type of allergic reaction for this child. We always want to assess the child's immunization status. And then, very important, we want to assess any medications that the child is taking currently. The dose, the schedule, and the last dose given is very important. And menstrual history in adolescent females is very important. We want to ask about the last menstrual period and any complications. Review of systems is a really important nursing action that allows the nurse to collect information regarding patient and family concerns, problems that may have arisen since the last visit, and it helps to direct the physical assessment and perhaps call for further assessment as needed. See Table 32.1 in the Ricci text for questions for the review of systems. A key part of health history is obtaining family history to assess for health risks in the patient. Ideally, 3 generations of health information should be collected. This can help to guide health planning. It can provide information and suggest health screenings, and can help prevent long-term or chronic diseases. One way to express family history is through a genogram. An example is in your Ricci text, figure 32.1. Once we've completed the health history, it's time to perform a health assessment and physical exam on the child. Each situation varies slightly, and each examination needs to be approached individually. The exam should reflect each nurse's personal style, and it should take into consideration the developmental age and stage of each child individually. We need to provide a proper place for examination and encourage support from caregivers. See Table 32.2 in the Ricci text for excellent guidance on developmental considerations for examination and the direction of examination. Assessment of newborns and infants. Encourage caregivers to either hold older infants in their lap, or newborns especially. It may be easier to examine them if they are on an examination table, perhaps on a warm blanket. It's wise to auscultate heart, lungs, and abdomen while the baby is quiet or sleeping, and count heart rate and respiratory rate before disturbing the baby to remove clothing. Infants and newborns should be examined completely unclothed, leaving their diaper in place until it needs to be removed to examine the genitalia. – Proceed with assessment in a head-to-toe fashion. Active toddlers can be quite the challenge to examine. Often, toddlers experience stranger anxiety and do not respond well to strangers touching or approaching them. When the nurse knows this, often ignoring the toddler during the collection of the health history can allow the child to have time to observe the nurse and observe the caregiver's reaction to the nurse to decide if the toddler can trust the situation and the nurse. So ignoring can be a great tactic for toddlers. Incorporating play into the examination can be very helpful. Playing peekaboo with the eyes and the ears can be very helpful in allowing the toddler to handle equipment such as stethoscopes, or in this photo you can see the baby holding part of the nebulizer as appropriate. Toddlers may want to keep their caregivers very close, such as sitting in their lap for the examination, but some toddlers may do much better if they're allowed freedom of movement rather than being held down. Let's discuss preschoolers. Developmentally, preschoolers are developing fears and often fear bodily invasion and mutilation, and they may withdraw from procedures or assessments that they view as intrusive. Preschoolers love to help, so utilizing their sense of initiative may lead to cooperation, allowing the child to help by listening to mom or dad's heart rate or hold equipment can be very helpful. Also, preschoolers enjoy having choices, so asking them which ear they would like examined first, or whether they want their left or right arm for their blood pressure can be very helpful as well. Most school-age children are very cooperative with examination. Their thinking is concrete, but they can be objective and realistic. Avoiding medical jargon and words with double meanings that they may not comprehend is important, because those things can lead to anxiety. Providing truthful and simple explanations can help ease any anxieties that they may have, and it's very important to provide privacy, respect the bodily autonomy, and respect for the feelings of the child as the examination proceeds. Important considerations when assessing adolescents include providing privacy for dressing and undressing, and providing proper draping or gowning to maintain modesty and privacy during examination. Maintain an attitude of respect. Maintain a head-to-toe approach. Provide matter-of-fact reassurances of normal findings, and allow for open-ended questions and encourage communication throughout the examination process. Let's review the steps of physical examination, beginning with observation. Observation can give you a wealth of information before you ever touch the patient, checking color, warmth, characteristics, and texture visually, and noting any odors. Palpation is laying our hands on the patient, validating our observations. Percussion is an important tool to determine the location, size, density of organs or masses. And finally, auscultation is listening to the heart, lungs, and abdomen with your stethoscope. Let's review the components of a complete physical examination. Include assessment of the general appearance, vital signs, body measurements, and a pain assessment. That will also include a developmental assessment in pediatrics. Examination of the head, neck, eyes, ears, nose, mouth, and throat, skin, thorax, lungs, breast, heart, peripheral perfusion, abdomen, genitalia, and rectum, musculoskeletal system, and neurological system. Pediatric physical examination considerations. At every visit, vital signs of each child should be measured. Vital signs do vary in the pediatric population according to age and gender. Please see Table 32.2 in the Ricci text for heart rate and respiratory rate ranges according to age. Accurate body measurements must be obtained to assess growth, including height, weight, head circumference, and body mass index. These findings should be plotted on growth charts to obtain percentiles to ensure proper growth and development. Head circumference is measured for children at each visit from birth until age 3, and then yearly to age 6. Measurements should be started at right above the eyebrows with the measuring tape around to the back of the head right above the occipital prominence. The anterior and posterior fontanelles should be palpated, and any lymph nodes in the head and neck should also be palpated. Large fontanelles may be associated with Down syndrome or congenital hypothyroidism and should be evaluated. An important pediatric consideration is the assessment of secondary sexual characteristics using the standardized Tanner staging method. It's important to provide privacy when examining adolescents and children for secondary sexual characteristics. It's important to use matter-of-fact terms and provide education regarding normal body changes and normal findings. This is an opportunity for nurses to provide health promotion and education regarding puberty and body changes. Tanner stages 1 through 5 are used to assess breast changes, female secondary sex characteristics, and male secondary sex characteristics. Please note the pictures provided in figure 32.28, 32.34, and 32.36 to further study the Tanner staging method. So what have we learned regarding pediatric health assessment? Some pediatric pearls of wisdom when approaching children: to remember to use a non-threatening room or environment. For younger children, provide toys and games. Encourage caregiver participation to put smaller children at ease. And very importantly, allow privacy and respect for adolescents. When determining if children are ready for their examination, some good signs to look for are they talking to you? Are they making good eye contact? Are they accepting equipment which is offered to them? And do they allow you to touch them? These are signs that they are ready for you to examine them. Not every exam will go smoothly, especially with younger children in the toddler and preschool ages. So what if they're not ready? Remember the ignoring technique. Simply ignore them during the health history, talk to the parents, let them play in it and explore the environment. They'll try to figure out why you're not interested in them, and it will help them to become interested in you and what you're doing. In older children, remember to compliment them, break the ice with a funny story or joke, perhaps learn a magic trick, or have a special toy or a bag of tricks that you can pull out to engage the children. Teenagers, it's important to communicate with respect, ask them what they're interested in, and try to bring out points of interest that you can talk with teenagers. What if you've tried all of these tricks and you still have an uncooperative patient? This can happen, especially for toddlers and preschoolers. So what do? Ask yourself, why are they uncooperative? They may have had a very bad experience previously. They may be anxious. Are they separated from their caregiver? Once you've gone through all the steps we've talked about, sometimes you just have to do a quick but thorough exam. It's important to avoid long-winded explanations. Communicate with the caregiver that you're going to be very quick but thorough and just get through it. Approaching the child in a calm manner and a quiet voice can make all the difference. Remember, most of the time, if you remember those developmental ages and stages, and remember how best to approach most children and individualize those approaches as needed, most exams are easy to accomplish, but sometimes you'll have a difficult one. The important thing is to try your best and be quick and thorough to gather the information that you need.